India's Universal Immunization Program (UIP) has seen several reforms, and new vaccines have also been introduced in recent years. This demands frequent training, as well as refresher training of the health workforce. Due to the large number of healthcare workers, it takes very long to train everyone. Trainings also mean keeping them away from their work, and sometimes also their homes. Hence, we developed a training platform, RISE, Rapid Immunization Skill Enhancement App, that could address these concerns. RISE is an innovative learning methodology that leverages technology such as the internet and mobile phones, laptop, etc. to enable health workers improve their immunization knowledge via a mobile-based application. It provides easy and anytime access to learning material and helps to track data and performance of teams. Also, RISE perfectly complements ongoing immunization trainings and is based on the most current immunization guidelines of the Government of India. While developing the RISE platform, a user-centered approach was used to identify the actual training needs of the users and design an application to build their knowledge and enhance their skills. We met health workers and supervisors at all levels to understand the gaps in existing practices and assess their training needs. The findings were disseminated in a national dissemination and brainstorming workshop where several dignitaries were present. The discussion in the workshop guided us in deciding the content and methodology for RISE. To meet the needs, we looked at access to technology and found that most of the health workers have access to smartphones and were conversant with their use. RISE was developed to address the training needs of health workers providing immunization services. It improves access to learning when and where users are. As RISE was going to be implemented in different states, it was decided that the app and the learning materials would be made available in the local languages of the states. The RISE modules were developed using a consultative process with government and partner agencies. RISE was developed using adult learning principles. Each module has interactive audio-video content for learning, interspersed with games and quizzes for knowledge recall. It is flexible as learners can use it anytime and anywhere with internet connectivity on smartphones. It is equally useful to learners and supervisors as it provides ease of learning while tracking learner progress. A learning management system or LMS is used to deliver RISE modules. The LMS is easily accessible by learners and supervisors through their smartphones, tablets or computers. The LMS enables structured dissemination of course content, tracking progress, administering assessments and generating electronic certificates. Supervisors can use the LMS to access live dashboards in real time to identify the knowledge gaps of health workers and strengthen their supportive supervision. The RISE app was launched under the guidance of Ministry of Health and Family Welfare, Government of India. First, a national launch workshop was conducted. Subsequently, a series of workshops were conducted at the state level. After the launch, block-level orientation sessions for the learners and supervisors were organized to familiarize them with the RISE app. Once the block-level orientations were completed, 5 modules went live on RISE app between March 2020 to July 2020. The period coincided with the COVID-19 outbreak, which threw many challenges, but still the number of learners accessing the modules on RISE kept growing. What have been our results to date? More than 84% of learners in the 5 RISE states have completed all the modules. There was a significant increase in the post-assessment scores of the learners that indicates definite knowledge improvement among the learners. To analyze the impact of RISE training, the project carried out a baseline and endline assessment. We found that there has been an improvement in the knowledge levels as well as in the quality of immunization practices of the learners. With the demonstrated increase in the knowledge and skills of health workers in pilot phase, the natural question to come is scale up. The RISE project can be easily scaled up across larger geographic area, and the Government of India has already started exploring the possibility for phase-wise scale-up. The RISE platform can also be used for training other cadres of staff and on different subjects too. The project has used a technology which is easily available and feasible. Its cost is reasonable when considering the huge number of health workers that can learn using RISE. It has been warmly accepted by all levels of health workers. All this makes RISE an easily sustainable learning methodology. Before we wrap up, let's hear what the users have to say about their first-hand experience using the RISE app.
हमर भी जा डाउट थिला सेटा भी क्लियर हैला आउ को नुवा किछि सिखिलु जोडा मैं जानि नथिलु सेटा मैं सिखिया को पाइलु गवर्नमेंट सेक्टर माध्यम रे जो वीडियो उडा थिला राइज रे सेटा हमको बहुत उपादेय हैला हम इम्यूनाइजेशन पॉइंट रे देखिया पई करिया पई सिखिया पई.
Let's see the testimony of various other users too.